Let's start with talking about the problems that research has shown might develop if we are overweight or underweight. So the diseases that people tend to die from in developed countries, including the United States, they tend to be related to obesity. And so if we can control obesity, we might be able to help people to avoid these conditions or delay them. So heart disease is clearly linked to obesity, and it's one of the top killers. Cancer, certain types of cancers are related to obesity, although not all of them are. And then, of course, there are some conditions that are not obesity related, like unintentional injuries and influenza, pneumonia. So we do know that there are a number of different conditions that are related to obesity. That is, they get worse as a person becomes more overweight or obese. So hypertension is high blood pressure. Dyslipidemia is that elevated total cholesterol, elevated triglycerides, elevated LDL, and a decrease in HDL. Type 2 diabetes we've talked about, heart disease, gallbladder disease. And then obesity is related to chronic inflammation and metabolic syndrome. Remember, we talked about metabolic syndrome in a previous chapter. Now, the good news is that all of these conditions then do show improvement with a little bit of weight loss when somebody is obese and suffering from them. And here are some more disorders related to obesity. Osteoarthritis gets worse as a person becomes obese, and the tricky part is that osteoarthritis then keeps a person from being physically active because they're in pain, and that then further leads to a worsening of the obesity. It's similar with sleep apnea. So sleep apnea is when a person stops breathing during sleep, and it is because of a collapse of the airway when they're very relaxed and sleeping. The picture here is of a person that's wearing a CPAP machine, which helps them to keep breathing while they're sleeping. So sleep apnea then, it's a chronic condition that a lot of people are walking around with and they don't even know it, but the person is always exhausted. And if you are obese and you have sleep apnea, so you're always exhausted, you're not going to feel like doing healthy choices. You're not going to feel like cooking healthy meals. You're not going to feel like getting exercise because you are chronically sleep deprived. And so it's a very vicious cycle. You have to treat the sleep apnea first to help the person lose weight. And then there are certain cancers that have a clear link to obesity. Gestational diabetes has a link to obesity, and then depression actually has a link to obesity as well. We talk a lot about obesity because more people suffer from obesity, but there are clear health risks to being underweight as well. When somebody is underweight, they usually do have nutrient deficiencies that go along with that. One of the outcomes of several types of nutrient deficiencies is anemia. Somebody that's underweight typically has a lower immune response and will get sick more often. And when they do get sick, they're less likely to survive a severe illness, and it takes them longer to fight off that illness. A person who's underweight also has increased risk for surgery complications, as well as fertility issues for women. And then osteoporosis happens quite a bit in women who are underweight their entire life. In children, we see a decreased growth. So how do we determine if somebody is at a healthy weight or not? Well, the first place that we start is the BMI. And you've probably heard about BMI before. It's your body mass index. This is a measurement that we use for adults. We don't really use it for children on its own, but for adults, the BMI is your ratio of your weight to your height. So once you reach your adult height, your height doesn't change, but your weight can. And so this is a calculation that takes that into account. So you can use these calculations to figure out your own BMI, but there's plenty of online BMI calculators where you just plug in your weight and your height and you find out what your BMI is. And depending on what category you fall into, that dictates which weight status category you are qualified under. So if your BMI is below 18.5, you're underweight. The next category then, somewhere between about 19 to 25 is normal weight, and then over 25 up until 30 is overweight. And then if somebody has a BMI above 30, it's actually an additional category, which is known as obese. You may not have realized that overweight and obese are actually two clinically different categories. They're not the same thing. BMI charts can be very useful because you can find your height on a BMI chart, and then you can go up and down the BMIs and see where you would qualify for being the different categories. So for example, say you are a female at 5 feet 6 inches. So you find that over on the left, 5 feet 6 inches, and up until the 19, so everything below 19 is underweight. So a female that's 5'6" and weighs 115 pounds is considered underweight because she has a BMI of 18. She's considered normal weight anywhere in that green category all the way up to 24. So anywhere between 120 to 150 pounds, that's considered normal weight. Above that then, up until 30 is considered overweight. And then you can see that she heads into the obese category right around 190 pounds. Now, I want to point out that this kind of makes sense for females. It starts to not really make sense, especially for people with a lot of muscle mass, and in particular men. So think of a man that's 5'10". You can find that over there on the left. He would be underweight all the way up until 130 pounds. That is quite thin. If you think about a man that's 5'10" and he's on 130 pounds, he would look underweight to us. And then he's healthy weight. He's considered overweight starting at 175 pounds. And then he's considered obese starting at 210 pounds. So the problem is that this may or may not reflect reality. BMI does not measure muscle mass. And so if you have a person that has a lot of muscle mass, they may in fact be healthy, but still fall into an overweight category and maybe even an obese category. So that leads to the next thing we have to think about. On top of BMI, we also have to think about body composition, because BMI only tells one side of the story. It tells us what you weigh for your height, but we don't know what that's made up of. So here's an example of a 5'11" male that's a bodybuilder. So this person has 5% body fat and their BMI is 30.7. But a similar male of 5'11" that is not a bodybuilder but has a lot more body fat, this person is also a BMI of 30.7. They're both considered obese, but clearly they are not the same. And so that's the body composition. So our weight is made up of bone mass. About 15% of our weight is bone. Our organs weigh a little bit. And then our muscle mass and fat mass make up the rest of our weight. And this is where things can vary a lot. So somebody who's very, very active, and especially if they're doing a lot of weight training activity, can have a lot of muscle mass and very little fat mass. And then somebody who is sedentary and doesn't do a lot of activity at all, they can have a lot of fat mass, but not much muscle mass. Now, obviously, for health, we want more muscle mass and less fat mass. That is what's considered more healthy. And then there is some water weight on you, about 5 pounds, maybe even more of water weight that you can fluctuate from day to day.